All right, good morning and welcome to Future Focus. We are glad to have you today. We have an amazing guest with us, one of the more recognizable persons on the planet. He needs no introduction. We have joining us today Dr. Anthony Fauci. Dr. Fauci, welcome to Future Focus now.
Good. Thank you very much. It's good to be with you.
We are so glad to have you on behalf of Winston-Salem State University, our 5,000 students, 1,200 employees, 29,000 alums around the world. Dr. Fauci, we want to thank you for your service to 6 United States presidents, trusted advisor. And you are someone that we look for because you provide the public with great information, information that's digestible, information that we can understand. We love you here at Winston-Salem State University. We love you in the Triad. Had so many friends told me to tell you hello, too many to name, but certainly Bill Roper, who is interim chancellor at the UNC system, Dr. Norman Anderson, who served with you at NIH, Dr. Mandy Cohen, Secretary of Health and Human Services here in North Carolina. They all say tell you hello, and I'm glad to do that for them. Welcome to Future Focus. Everybody's excited that you're here. I know your time is valuable, and so I want to get in as much as we can about what's happening, with COVID-19. So, Dr. Fauci, if you would begin this discussion with just giving us, what's the latest science on this disease? What's the latest science on COVID-19? I know we've learned a lot. Where are we today in terms of what we know about this disease?
Well, there are two aspects of that. What we know about the disease, what we continue to learn, and from a scientific standpoint, what are we and what can we do about it in the form of countermeasures, such as therapies and vaccines. This is clearly a most perplexing disease. I had mentioned this when someone asked me over the decades, what is the thing that you are most concerned about? And what are the things that keep you up at night? I mean, that's such a common question for me. I might have forgotten to ask that 1,000 times. And what that is the emergence of a brand new virus, generally and almost certainly from an animal species where you jump to the human, of a respiratory borne illness that has the capability of spreading very efficiently from human to human, and that has a high degree of morbidity and mortality. We've had outbreaks that had one or other of those characteristics, but the perfect storm is when they all come together. Let me very briefly give you two examples. Back in the 2005 and then 2013, we had the chicken flu, the flu that was the so-called bird flu. It jumped from chickens to humans, high degree of mortality in humans, 35%, but it had no capability of going from human to human. So it dead-ended in the human. Very bad for the person that got infected, but not a problem for society. Then in 2009, we had the pandemic flu, the H1N1 swine flu that you all recall. That had a great capability of going from human to human. However, the mortality was very low. I mean, for a pandemic, it was less than seasonal flu. What we have now is the unimaginable. We have a virus that jumped from animal to human, that's respiratory borne, that has a spectacular capability of spreading efficiently from human to human, and has a high degree of morbidity and mortality, particularly in certain subsets of people, the elderly, those with underlying conditions, and a great disparity among minorities for a number of reasons. So that's what we're dealing with, a very unique virus. Its manifestations are, again, completely unique. I've been chasing viruses for 40 years now, starting way back in the 1980s with HIV/AIDS, Ebola, chikungunya, Zika, you name it. This is very unique for the following reason. With the same virus, it has the capability of 20 to 40% of people don't get any symptoms. Some get mild symptoms, go away in a day or two. Some have to stay in bed, sometimes for 3-4 weeks, and then feel wiped out for another week to a month. Others require hospitalization. Some of those require oxygen. Some of those require intensive care. Some of those require intubation, and some of them die. So the spectrum of disease completely confuses the American public, because you have some people say, why should I worry? This is a trivial disease. I'm young, I'm healthy, there's no problem. Not knowing that you might get infected. And by the way, it isn't so benign for young people. The more we learn about it, the more we see that young people are also getting serious consequences. But as a young person, you may get minimal symptoms, but you're part of the dynamic process of an outbreak, which means that you're contributing to the dynamics of the outbreak. So you may not get many symptoms, but then you go home, you infect someone who then infects an elderly person, could be your grandma, your grandpa, your uncle who has an underlying condition for which they're being treated. And even though you seem like it's not bothering me, you are propagating an outbreak. So that's a real messaging problem of how we can get young people to realize that as beautiful as the weather is here, I'm looking out the window here in Washington, it's a beautiful sunny day. You get the urge, you want to run out, sit at a sidewalk cafe, have a beer, do what you want to do. That's an understandable urge. The only problem is that when you are in an area where there's a high dynamic of infection, that is a high risk situation to put yourself in. And that's what we're seeing now along the Sun Belt. We're seeing it in Florida. We're seeing it in Oklahoma. We're seeing it in Arizona. We're seeing it in North Carolina. We're seeing it in places where earlier on there wasn't much infection. So we're learning every single day and every single week. Now we find out that there are some syndromes that we didn't even recognize before, like children getting this very perplexing hyperinflammatory syndrome, where they get a very, very serious disease following the infection with the coronavirus. We didn't realize that before. Young people are getting strokes and are getting problems with thromboses. So this, as more and more we learn, the more and more how much we're dealing with a formidable foe with this virus.
Wow, my goodness. Wow. Dr. Fauci, you know that the Office of Social and Behavior Science Research was created to kind of infuse into the NIH, looking more in terms of the social determinants of health. It's been answered by a lot of folks. No one has articulated this better than you. Why does this disease have a more devastating effect on African Americans?
Yeah, it's a double negative whammy for minorities, particularly African Americans, for the following reason. The social, economic, and other stratus in which they find themselves, that they have jobs for the most part. We never like to generalize, particularly when it comes to demographics and race and ethnicity. But in general, African Americans have jobs that are so-called important infrastructure. They're outside. They're doing things physically. So they don't have the benefit of doing what we can do, sit in front of a computer and do a job reasonably well without putting ourselves in danger. They're out there exposed. So number one, they have a greater likelihood of getting infected. And then number two, which is really important, is that this is something that is decades and decades old because of a number of factors, economic, social determinants of health. They have a much higher incidence and prevalence of hypertension, kidney disease, diabetes, obesity, all the things that when you do get infected with COVID-19 disease, that you have a much greater likelihood that you're going to have a poor outcome, that you're going to get hospitalized, that you're going to need intensive care, and that you're going to die. And the numbers speak for themselves. There is no argument about that. Take a look at the relative proportion of African Americans in a community. Take a look at what percentage of them compared to whites who are infected. Take a look at the percentage that becomes hospitalized, and take a look at the percentage that die. Every single number is a disparity against the African Americans.
My goodness. And when you look at similar moments in time, we've talked about this in terms of looking at what's happening in America today around race relations and what we're seeing, and people are saying it's a seminal moment. Given what this pandemic has done in terms of shining the light on health disparities in this country, what do you think it would take for us to have a sustained effort around trying to eliminate? Is this a seminal moment? And can we move from this space to have a concerted effort around eliminating health disparities in this country?
Maybe it's going to take something as dramatic as this to shake people into the realization that we have to do something societally about the health disparities, but that's so deep-seated. It has to do with the accessibility of health care, with early diagnosis, with getting people the right diet from the time they're children, so that their metabolic process in their body isn't used to getting foods that are high caloric, non-nutritional, so that by the time they're in their teens, they're sort of knocked out of kilt, their metabolic process, so that you wind up a greater degree of obesity, a greater degree of diabetes. I mean, people like to say, well, that's racially determined. No, it's really not. It ultimately gets expressed in certain demographic groups, but it's not. So I think you use the right words. I use it a lot. That when you have something as dramatic as this, hopefully that'll shake the cages enough and shed such a bright light on the disparities that we will do something about it that is sustained and not just lip service. You know, I thought with all the experience that I've had, since many of you know, I mean, my fundamental specialty in infectious diseases is HIV. I've devoted the last 39 years of my life studying HIV from the very first week it was recognized as a new disease without even knowing what the virus was. And clearly what you have is the same sort of thing. 13% of the United States population is African American. 45 to 50% of all the new infections are among African Americans. I mean, there it is again, you know, great disparities with important diseases. We've got to address that. We can't walk away from that.
Yeah. And while I have you, I can't let you go without talking about higher education. I'm a chancellor at Winston-Salem State University, and chancellors and presidents all across this country are scampering to make sure that we can have students back on campus. Will we get students back on campus? And I know your answer to this question. So, and I know you're going to say it depends. It depends upon the area. So I'm going to ask you a different way. I'm going to ask you, what percentage of positive testing would you be comfortable with in an area before you would say, I think students should come back to school?
Yeah. Well, there's a two-part answer, and I won't waffle on you, I promise. It's got to be the low single digits, number one.
Okay.
You know, a few percent at the most. And number two, it has got to be in a situation where the number has been consistently going down so that the momentum is in your favor. And that's the reason why when we put together the guidelines for opening America again, that's right there on the website, you know, coronavirus.gov, and you'll see it. We spent a lot of time putting that there, where you have a gateway, where you have to have a consistent diminution. Once you reach and pass the gateway, which is the first checkpoint, you go to phase one. Then you have to have a consistent diminution. If I see a university in whatever location they are on that downslope, I would feel much, much more confident about getting the school open to as normal as possible. Then, if I saw one that was really low, but they were creeping up, that's the thing you got to watch out for. Because when you have an infection, what you see today is a reflection of what happened a couple of weeks ago. And what you're going to see a couple of weeks ago from now is what's happening now. So if you're on the way up, you got to say, time out. We got to do something different. I like to see it on the way down.
Yeah, I like that. And you know, on university campuses, we're just constantly having major events almost every day. And so we talk about having large events. I've already at Winston-Salem State canceled homecoming. And you know, homecoming, if you know anything about historically Black colleges and universities, and I know you do because you're up there with Howard. Now, Howard has a nice homecoming, Dr. Fauci, but you've never seen a homecoming like Winston-Salem State. And you are my guest next year, 2021. You're coming to homecoming at Winston-Salem State.
All right, you got it.
Wait, what I want to ask you in terms of looking at preparing for sporting events and football, does the NBA have it right? And is that a model, the so-called bubble model? Is that, what do you think about that?
You know, it's one of the models. You know, it's very interesting. When I got asked questions like this from some of the officials of the NBA, the NFL, or what have you. I got into a little bit trouble with the NFL because they asked me. I didn't go to them and say, "Hey, here's what I think you should do." They asked me some questions, and I gave some answers that were purely based on public health. The spin that came out of it was that Fauci says we should not have an NFL season this season. So now I have a couple of hundred football players who hate me. And that's unfortunate because that's not what I said. I gave advice just the way we're talking now about the level of infection in a particular area. So getting back specifically to answer your question, the creating of a bubble is one of the potentially workable situations if you want a season and you're not concerned about spectators. You just want to get the players to be playing. Because if you could test them all, show they're negative, sequester them from the outside, and keep intermittently testing them, you could protect them, you could protect their families, because some of them say, I'll be in a bubble myself, but I don't want to be away from my family for a couple of months. So you got to make sure you don't have a situation where you're protecting them, but they're not protecting their loved ones. The answer is that is workable, but it's not up to me or the health officials. It's up to the league leadership, to the players themselves, particularly the players. I mean, they're the ones that are involved in this. They should have a very, very strong say in what goes on. Unfortunately, when things get spun, it doesn't go that way.
Yeah. And I know we're almost out of time. Thank you so much. But look, give me a couple of quick hitters. Second wave. What's the latest on second wave possibilities?
Okay. Well, I'll give you the same answer that I gave to the newspapers, which I didn't say got me in trouble, but it created a little bit.
We don't want to get you in trouble.
No, I'm fine. I'm not going to be in any trouble, but it's a little bit of a storm there. We shouldn't be even thinking about second wave. We are still knee deep in the first phase. I mean, look, the heck is going on. We had more than 30,000 new infections a couple of days ago. If you take a look at the curve, it's going up. It's not going down. That's the problem.
Yeah. And will we, as we look at this virus in the system, will it impact the flu season at all? My question is, will it intersect, maybe even to make the flu season worse?
Yeah, well, that's a great question, and that's what we're concerned about. So let us assume that we do, in the next month or so, get the infections in the United States way, way, way down. Whenever you get into a season that's a winter season, where you create conditions where it's easier to spread a respiratory infection, and you have another ongoing respiratory disease to complicate it, it makes diagnosis, identification, contact tracing much more difficult, because you have two intersecting respiratory diseases that have initial symptoms and maybe even many of the symptoms that are exactly the same. It would be an interface that would be very unfortunate, which is the reason why we have to have in place the manpower, the system, the tests to identify, isolate, and contact trace effectively. At the same time, it's really a good idea to get as many people vaccinated against the flu, so you could keep the flu levels down and you could focus more on the possibility of a return of COVID-19. It's going to be very, very complicated.
Well, I mean, that's great, because I actually had a question that someone asked me about the flu shot. Given the fact that, we have this virus in the system, should they get their flu shot earlier, is what someone asked me. You just mentioned something about a flu shot. About the flu.
Yeah, the general CDC recommendation, which I agree with completely, is that everybody should get their flu shot by October 30th. As soon as it gets into the stores, whatever stores there are with you guys, CVS, Walgreens, or whatever, your own physicians, the clinics, you might even do it out of your own school, is to get people vaccinated as soon as the material is available, but no later than October 31st.
Yeah, well, great. And last question, tell us about where we are, the status of getting a virus for this.
Getting a vaccine, you mean?
Oh, what did I say? No, we don't want to get the virus. Thank you. A vaccine for the virus.
Okay, that's good news. That's good news, because we have a number of candidates that are well along in the clinical trial process. One of them will likely go into phase 3 for efficacy sometime mid to late July. Then another candidate will go in August. We hope, which is aspirational with no guarantee, but we hope that we will have a candidate that will at least know whether it works or not by the end of this calendar year and the beginning of calendar year 2021. So I'm cautiously optimistic that we will have a vaccine of some sort as we enter into 2021.
And Dr. Fauci, in terms of dealing with this and all the work that you've done, has this been the most challenging thing that you've had to deal with?
You know, in an acute stage, yes. The most challenging on a long-term basis was the evolution of HIV/AIDS, no doubt. But something that is compact and compressed into 4 months, this absolutely takes the cake for that. I mean, there's nothing as intense and devastating as a global pandemic that has essentially locked down the entire planet, where there was nothing there in January, and now all of a sudden we're in June and the whole world is shut down. I mean, that is unprecedented and completely historic.
Wow. Dr. Fauci, thank you so much for your time. You've been so generous to come on Future Focus. We wish you well. I've read about you. I read about your tremendous work ethic, how you work like 20 hours a day. And I want you to slow down a little bit. And I want you to take it easy and stop doing all of these things.
I will promise you that someday I will do that, but not now. Nice to be with you all. Thank you for having me.
Yeah. All the best.
Yeah, thank you. Take care of yourself.
All right. And welcome back to Future Focus, following just an amazing interview with Dr. Anthony Fauci, who really shares some great information. And he is the voice of public health and healthcare in this country. And we're very excited to have him on Future Focus now. So we're back with the Dr. Anthony Fauci's of Winston-Salem State University. We have joining us today, we have Jason Stogner, who is Director of Emergency Management, and we have Sarah Isom, who is Assistant Director of Emergency Management at Winston-Salem State University. You guys were here, you heard Dr. Fauci's interview. I'm interested and curious about your reaction to the interview, Jason.
Thank you, Chancellor. And what big shoes to fill following Dr. Fauci. Really appreciate his leadership and his expertise. And I guess just the one word is wow. What you heard was how difficult and challenging this pandemic has been and how we're still continuing to learn. I think that's what really hit home with me, is we know more about the virus than we did, back in January or early March, but we're still continuing to learn. But we're seeing, how it's changing and how it's impacted the communities and disparities in the minority population. So as you can see, it's been really challenging, and it's a continued marathon. I heard on a conference call last week, this is not just a sprint we're running, but this is a marathon, and it's a marathon without a finish line. And I think Dr. Fauci highlighted that and the importance of what we're doing.
I thought it was an amazing interview. He talked about the complexity of this disease and how it strikes so many folks in so many different ways, and we're learning so much about that. That struck me as well, Jason. What about you?
So I think to be in the same virtual space as Dr. Fauci is an honor all on its own. But to be able to respond to his comments it just feels like my public health dream. I never knew that that would be something that I dreamed about until this year, 2020. But I think the challenges he described are exactly what we've been struggling with from the very beginning. And it's an ongoing learning process, learning every single day something new about the virus. And that's from Jason and I's emergency management standpoint. So I can only imagine from an actual medical and clinical space what that also feels like. So I think it was very eye-opening and humbling all at the same time.
Absolutely. And so one of the things, and the reason why I wanted you guys to follow Dr. Fauci is because of the work that we're doing at Winston-Salem State in preparation for students to return to campus this fall. But before we get into that, I wanted you, Sarah, because of your background and the work that you've done over the past 2 years, to really kind of give us a Reader's Digest version of what a pandemic is, where our audience can, and we want to catch them up before we get into what we're doing on our campus.
Of course. So a pandemic is something that basically is defined as an epidemic, which is a disease occurrence that occurs worldwide or over a very large area, a very wide area, and usually crosses international borders, affecting multiple countries and continents, and also affects a large number of people. This is a classical definition of it. It doesn't include seasonal epidemics such as seasonal flu. But with that being said, pandemics can occur in multiple waves and they occur in multiple phases. So this is very interesting because there's a lull in pandemics where we can become very kind of blasé about it, and we don't realize that we're actually ramping up for a second wave. And as Dr. Fauci said, we're not even at the second wave yet. We are still knee deep, quote, in the first wave. So it's not time right now to be thinking second, third, and what are we going to be doing 6 to 12 months from now, because we need to keep reacting to what's happening right now. Pandemics are finicky in that way, and it's a big thing to deal with. It's a lot. There have been preparations on the public health side for all sorts of pandemics for years. And Dr. Fauci mentioned some of those. So it's H1N1, or what he called the chicken flu, that first avian flu. You can look all the way back to 1918 about, the very big Spanish flu, or the influenza virus at that time. That first wave hit in the spring, and it kept going into 3 waves. So pandemics are not something that we can mess around with, and we have to remain vigilant on. But the big hallmark of it is it's large, it happens in different waves, it crosses those international borders, and it infects a large number of people. What is hard about this one, it's a novel virus, and that just means it's new. And to echo another one of Dr. Fauci's remarks of, when we have that spillover, or when a virus moves from an animal to a human, that's big in and of itself. But then when it goes from human to human is where we're really in trouble and eyebrows start raising. So it's very, very, very important that we remember how that occurs and how we can respond to it. And that is what is so interesting and deadly and intense about this virus and this pandemic right now.
All right. One of the questions that I asked Dr. Fauci was about returning to campus and schools, and I knew his response was going to be that it depends upon the area and what's happening in that area. Jason, take us through what's happening in North Carolina right now in regard to this pandemic.
Sure, Chancellor, and we're not moving in a positive direction. And last week you had Dr. Mandy Cohen on, and she gave a little bit of insight on North Carolina, but the trend is still not in the direction we would like to see. America, we have about 2.3 million cases, and just in North Carolina, I think the numbers are a little over 54,000. And I'm particularly concerned about the Triad area. Forsyth County is now in the top 4 counties in the state with growing cases. So we're not moving in the right direction. As a state, Governor Cooper and Dr. Cohen have done a tremendous job providing leadership and guidance, and it's really tough decisions, balancing the health and safety also with the economic and financial situation. It's challenging. There's hard decisions that have to be made. But as a state, we're continuing to operate in phase 2 through the 26th of this month. We expect an announcement from the governor's office with updated information. And they'll be looking at, Dr. Cohen shared the 4 different metrics and different information they're looking at when they're making that decision. But as a whole, we're not moving in a positive direction. I know folks, we've been dealing with this since January, ready to get out of the house, but it's very important that we maintain the social distancing. You wear your mask, the 3 W's, wear, wait, and wash, and make sure we continue to follow public health guidance because, as Dr. Fauci said, we're not out of phase 1 yet.
Yeah, when we think about the percentage of positive folks, we test a lot of people. We've heard that, but I think the statistic that we look at is the percentage of positive tests that we get. And I asked Dr. Fauci, and he really talked about getting into the single digits. Where are we in North Carolina in terms of percentage of positive testing?
So I believe Dr. Mandy Schroeder, we were hovering around the 8% last week. So we really need to get that reduced. As Dr. Fauci shared, you really want to be in the single digits. And again, we're not there yet.
Yeah. And so one of the things, I was listening to the governor of New York, and you think about that being at one point the epicenter of this pandemic. He talked about they're now at about 2 to 3%. How did they do that?
So it boils down to testing, and it boils down to contact tracing, and then it boils down really there's individual ownership. So we as citizens need to make sure that we maintain our social distancing as we wear our masks, that we're doing our due diligence and allow the contact tracing and the other public health measures to work. But it really takes individuals being responsible, doing their part. We're all in this together, but it's going to take each and every one of us to be responsible in order to reduce the numbers.
Jason and Sarah, we work every day. It seems like we work every day in terms of preparing the campus for students to return, for faculty and staff to return, for visitors to return to our campus, to try to see if we can also have athletic events. We work, it feels like, around the clock. I need for you and Sarah to talk a little bit about what we have been doing to make sure that when people do return to campus, they're returning to a safe campus, and we've done everything possible to make that happen. Jason, I'll let you talk first, and then I want Sarah to talk about some of the work that she's doing as well.
Sure. So that they have certainly been long days and long weeks and long months, and we've put in tireless hours. And when I say we, I mean the entire campus community. This has been a tremendous team effort. And everyone is working longer, working harder. And we've been meeting weekly with policy team, with administration, with executive staff. We've been meeting weekly with our operational group, which is divided up with leadership from various departments across campus. We've been meeting weekly with our county public health agencies, our emergency management agencies, been working with the UNC system guidance, been working with other area schools. We really have been having some transparent and honest conversations about how we can better protect our campus community. And that has been the number one objective, the main goal of everyone, to make sure that we protect the health, safety, and welfare of our campus community, all faculty, staff, and students. So we've been a tremendous work in planning and collaboration, doing a lot of scenario based. As you heard Dr. Fauci and others share, this has continued to rapidly evolve. It seems like every day there's new information. Every week there's different guidance. So we've been trying to stay abreast of those changes and then to make sure we incorporate them into our plans. And it's been challenging because there's oftentimes been more questions than there have been answers. And sometimes we haven't had answers, but we've had to continue moving forward. We've put together task force and working groups to look at protective measures across campus. And you say, what does that mean? I think the best comparison I can give that people relate to is kind of the grocery store model, where you see increased signage, you see increased hand sanitation of the carts, you see kind of the floor tape or directions to maintain 6 feet apart while you're waiting in areas. You see the sneeze guards or protective screens at the cash registers, and then you see the mask of the grocery store workers. We're looking to implement that same model on campus. So have increased signings, have increased hand sanitizer stations, have the different screens, looking at our capacities, looking at our occupancy loads for the different rooms. So when it comes to academic continuity and classroom space, putting classrooms in larger rooms, thinking outside the box and looking at non-traditional classroom settings, looking at gyms or other larger venues where we can put classrooms. but really continuing to think outside the box. When we're preparing for the return of faculty and staff and students, again, their health, their safety, their well-being is our utmost priority. So we're putting together campus preparedness kits. So in those kits, there'll be cloth masks, there'll be wipes, there'll be hand sanitizers, there'll be tissues, there'll be other things to help them help us. Again, it's going to take each one of us as a family to do our part, to do our due diligence, and to be prepared.
Definitely. I 100% agree. I think, as Jason said, preparing campus is a large endeavor, and it takes a huge team effort. And one of the biggest aspects of making sure that we inspire some of this behavior change, because it's really unusual to tell people all of a sudden, wear masks in public spaces, stay 6 feet away, or go through different exits and entrances, or go down a grocery store aisle, in a certain way. I gloss right over those signs because it's not a habit. But that behavior change is increasingly important when our campus community returns in the fall, because COVID-19, it's not going to disappear. It's going to remain in the forefront, and it needs to remain in the forefront of our minds and in our daily actions. And in a way, those protective measures that we need to take become a habit and that mode of personal responsibility. So we can give the tools to do that, such as those personal preparedness kits or the return to campus kits and those cloth masks and the wipes and the hand sanitizer, but people still have to participate in that and do their part. Those numbers aren't going to go down without people taking that personal responsibility and taking into all of those social distancing measures and actually putting them into play. And I think one of the biggest things that we have worked into our emergency planning and our response planning and our recovery planning is that education factor. A lot of different parts of this campus are moving in many different speeds and directions, which is great. That's how a campus works. But for COVID-19, they've done an absolutely amazing job of working together to assist us in this planning effort and to make sure that we're not siloed, we're working, and we're a cohesive unit. And that is what's going to really assist us in opening campus back up in a safe and healthy way for this population.
Great. Sarah, take us through the science of wearing a mask and why it's important to wear a mask, because when we return to campus, we will see that mask will be everywhere and everybody will need to wear a mask. So
definitely. The face masks, they're crucial in this battle against this virus. The CDC recommended that everyone wear a cloth face covering or a cloth mask when they go out in public. They really help prevent the speed or the spread of the virus from those with it. And as Dr. Fauci mentioned earlier, 20 to 40% of people, and that's a very rough estimate, but that's an amount of people who may have the virus and may be shedding or spreading the virus and might not even know it. So that cloth face mask or that cloth face covering helps you keep your germs to yourself in a way. You are already infected and you could be spreading it on. And so you keep it to yourself. And the risk of transmission with that cloth face covering is significantly reduced. Now, that's great when one person is wearing it, and it's even better when someone else in that area who may not be able to be 6 feet away is also wearing that cloth face covering, because now you have something keeping your germs to yourself, and then another person who is at risk of receiving the virus now has something effectively blocking the route of transmission. So it's not perfect by any means, but it is one of the best ways that we can assist in a protective measure and protect the population. Anyone that cannot maintain that social distancing and other preventive measures, that is an addition to it. So it's very important that you have it and you honestly keep your germs to yourself.
Great. Now, what about face shields? You can see my face shield. In fact, I got up this morning and presented a face shield to Denise. And
Okay.
I said, this might help you, because she talks a lot about wearing the mask and she wears glasses and it fogs up her glasses. And someone presented this as a possibility to deal with that. What about face shields, Sarah?
So with the face shields, while they do provide a barrier, Chancellor, they are not the CDC recommendation of a cloth face covering. So it would go against my public health soul to give you a recommendation directly against the Centers for Disease Control and Prevention. But I think that if people are unable to wear a cloth face covering, or maybe if Ms. Robinson is driving and doesn't want to fog her glasses or something like that, that is something she can add in addition to maybe other protective measures, such as the social distancing.
Yeah. So one of the things I got into just a little bit, Jason, and I know that you have been involved with the Department of Athletics, and that is about sporting events. And we did not get into large crowds. So talk a little bit about the work that you have been doing with athletics.
Sure. So we've been meeting really heavily with athletics and working with them, and they've been working directly with conference partners and then looking at, kind of industry best practices and standards. And there's a lot of factors that you have to consider when looking at athletics because of the close contact and just the nature and competition of sports. So I don't want to say a different group or a unique group, but there's some unique circumstances that certainly have to be considered when you're addressing how they return, when they return, and what competition potentially looks like this fall. As you've seen in the news, LSU and Alabama and some other Division I schools that have returned, they're already seeing increased caseloads with student athletes. So we've got to, again, make sure we're doing our due diligence, make sure we have proper plans in place, make sure we're following the latest guidance and doing everything we can to protect our student athletes.
And I want the public to also know that we're not doing this alone. Talk a little bit about partnerships in the triad and in Winston-Salem to help us deal with this.
Absolutely. Yeah, we could not do this alone. And we have been, again, meeting weekly with our county public health department. They have been tremendous. We have been in conversations with our local healthcare providers, Wake Forest Baptist Medical Center, also Novant, and then also working closely with Forsyth County City of Winston-Salem Emergency Management, and making sure we stay in close contact with School of the Arts and Forsyth Tech and Wake Forest University, because again, we have a population that is returning from all across the state, from all across the country, and various parts of the world. So international students coming into town, and they're not just coming to Winston-Salem State University, they're coming to the city of Winston-Salem, they're coming to the Triad area. So we need to make sure that we're all in this together, that we have consistent protective measures in place. That way our standards are consistent. That way when you're traveling from campus to campus, you see similar measures being taken. You understand what the expectations are. And again, making sure we're being coordinated, making sure that we are united, because we are not in this alone, and we are working hard to stay in constant communication and coordination with not only our campus community and our campus and our county partners, but also with the UNC system. So we're working with all of the 17 institutions, making sure, again, we have that one message, one voice, trying to do things consistently, and then also sharing best practices. There's some things that others may have thought about that we haven't considered. So making sure we're not only sharing with them what works for us, but we're also utilizing their best practices and creative ideas that they've discovered.
Great. I asked the two of you the same question that I asked Dr. Fauci, and that is, what have you learned during this pandemic? What do you know now that you didn't know before regarding either pandemics, public health, or emergency management?
So I'll start, and then we'll let Sarah finish. But I think the biggest thing we've learned is that to really remain flexible. So our current plans, our current pandemic procedures, we've kind of had to throw them out the window and kind of start anew. In some ways, flying the airplane as we've been building them. But I think number one is to remain flexible. I think the second thing we've learned is to make sure we increase our redundancy. Again, for these long events, it's important to make sure we have the appropriate resources and staff, because people do get tired. The days get long, the weeks get long, but there's still a tremendous amount of work to do. So making sure we have kind of players on the bench that we can pull from, put them on the court. And just making sure we continue to increase our emergency management capability. Emergency management is not just our office, it's each one of us. It's us as a campus developing a resilient program to respond.
I definitely agree. And really, other than learning just how much coffee Jason and I can actually consume without being medicated, I think we've really learned how important it is to remain in this cycle of planning and really getting comfortable with change, because when you're uncomfortable with it, you serve as your own roadblock. And in our favorite term of rapidly evolving, it's a new situation for a lot of us, and we're constantly learning new information and have had to remain very vigilant about that information and make sure that we're incorporating it and getting used to the changes that we know are coming and really just roll with it. I think that's been very important, and really take that information, learn from it, incorporate it, and educate as best as we can, and then keep moving forward.
One of, for me as chancellor, I think one of the best parts of the team and great work that has been done in terms of our residents and our housing. Those folks have been incredible in terms of thinking about that. I can imagine that there are a number of students who are concerned about the residence hall. Tell us how we've been preparing to make the residence hall also safe.
Sure. So Housing and Residence Life has done a tremendous job. They have put together several different plans, not only isolation and quarantine, but they've put together plans on cleaning and disinfecting, on what to do should we have a case. Also looking at the requirements for the mask. So again, social distancing, mask are the two primary things we can do. And then also looking to increase the hand sanitizer stations, making sure they're readily available, almost to where students have to almost walk into them. We want people to use them. We want them to kind of be out in front. Again, like the grocery store model, you see it. We want students to know that these resources are there. Please use them. But again, it's going to take each and every one doing their part. But Housing and Residence Life has been outstanding throughout this process.
Yeah. And one of the things I also want to make sure that students understand that this is a community effort, and we need them to participate in this process as well. So when they return to campus, we want to create a different culture, a more healthy, a more clean culture around that. And that's how we kind of get through this together. Right? Right, Sarah? Right?
Definitely.
It's a community.
Changing that culture and creating kind of a new habit. As I mentioned earlier, some of this stuff isn't normal for us. I don't, at the beginning of it, did not disinfect my keyboard or my steering wheel or the handles in my home every single day. Now, if there was a flu outbreak or, someone in my household was sick, I would, but this is going to have to become a habit, and that education component is increasingly important. And Housing and Residence Life on our campus has done such an amazing job of integrating that education into their planning, and making sure that those students have the opportunity to really learn about that personal responsibility and really put it into play.
All right. Look, I want to thank the two of you for coming on behind Dr. Fauci. You're great sports, and I appreciate that. I also appreciate the work that you do, and I say this publicly, that I think that we have, in terms of Jason and Sarah, the best emergency management team in the country. And it's because of you and because of everyone else at Winston-Salem State University that I am comfortable with the work that we're doing and how we're creating a healthy and safe environment for students to return. And so I want to thank you for joining me today on Future Focus Now.
Thank you, Chancellor.
Thank you, Chancellor.
Thank you. We'll see you next week for another edition of Future Focus Now.